Perimenopause is initiated by a decline in ovarian function. This decline results in irregular hormone production within the ovaries. This stage signifies the transitional phase leading up to menopause. A key characteristic is the fluctuation of estrogen levels. Progesterone levels also experience significant variations during this transition. Perimenopause disrupts the endocrine system's feedback loops. The hypothalamus and pituitary glands struggle to regulate ovarian hormone output. This struggle leads to hormonal imbalances. These imbalances are a key characteristic of perimenopause. Estrogen fluctuations significantly influence neurotransmitter activity in the brain. These hormonal changes are closely linked to alterations in emotional state. Mood swings are a common manifestation of fluctuating estrogen levels. Increased anxiety can also be attributed to these hormonal shifts. In some cases, depression may arise due to the impact of estrogen on brain chemistry and emotional regulation. Declining estrogen levels affect the vasomotor system. This hormonal change can trigger hot flashes. Hot flashes are characterized by sudden sensations of intense heat. These sensations result from the dilation of blood vessels near the skin surface. Fluctuations in estrogen levels can disrupt the menstrual cycle. Changes in progesterone levels also contribute to menstrual irregularities. These hormonal changes can lead to unpredictable menstrual periods. Irregularities may manifest as alterations in menstrual flow. The duration of menstrual periods can also be affected by hormonal imbalances. Changes in the frequency of periods are another common symptom of disruption. Reduced estrogen levels significantly impact the urogenital system in females. One primary effect is vaginal dryness, caused by decreased estrogen production. This hormonal shift also leads to the thinning of vaginal tissues. The combination of dryness and thinning can cause considerable discomfort during sexual intercourse. These changes increase the susceptibility to urinary tract infections, UTIs. Therefore, estrogen plays a vital role in maintaining the health and function of the female urogenital system. Estrogen is critical for maintaining bone density. A decline in estrogen levels occurs during perimenopause. Reduced estrogen increases the risk of osteoporosis. Osteoporosis, in turn, elevates the risk of bone fractures. Estrogen plays a significant role in protecting the cardiovascular system. It contributes to maintaining healthy blood vessels and heart function. Estrogen helps regulate cholesterol levels, promoting a favorable lipid profile. It also has anti-inflammatory effects, reducing the risk of plaque buildup in arteries. Decreasing estrogen levels can compromise these protective mechanisms. Consequently, reduced estrogen can increase the risk of heart disease and stroke. Hormonal fluctuations can significantly disrupt normal sleep pattern. These disruptions often manifest as insomnia, characterized by difficulty falling or staying asleep. Sleep disturbances, such as restless sleep or frequent awakenings, are also common. Changes in the production and regulation of melatonin, a key sleep hormone, contribute to these issues. Maintaining hormonal balance is crucial for promoting healthy and restorative sleep. Perimenopause can affect metabolism. This can lead to weight gain. Changes in body composition are also common. Decreased estrogen levels play a role. Estrogen influences fat distribution and muscle mass. Reduced estrogen levels significantly impact skin health. Lower estrogen can alter skin elasticity, making it less firm. Collagen production, vital for skin structure, also decreases with reduced estrogen. This decline in collagen leads to increased skin dryness. The skin becomes more susceptible to wrinkles due to these changes. Overall, the skin becomes thinner and more vulnerable to damage. Hormonal fluctuations can significantly impact hair growth patterns. These changes often manifest as hair thinning or noticeable hair loss. Androgen levels, a class of hormones, are frequently implicated in these hormonal effects. An imbalance in androgen levels can disrupt the normal hair growth cycle. This disruption can lead to a reduction in hair follicle size and activity. Consequently, hair may become finer, weaker, and more prone to shedding. Perimenopause can trigger cognitive changes in some women. These changes often manifest as memory problems. Another common symptom is difficulty concentrating. These cognitive symptoms are frequently interconnected. Hormonal fluctuations are often linked to these cognitive shifts. The severity and type of cognitive changes can vary among individuals. Decreased estrogen levels can lead to the weakening of bladder muscles. Weakened bladder muscles contribute to the development of urinary incontinence. Urinary incontinence is characterized by the involuntary leakage of urine. Estrogen deficiency can also cause an increased frequency of urination. Therefore, reduced estrogen levels can significantly impact bladder control and function. Hormonal fluctuations can significantly influence digestive processes. These hormonal shifts can manifest as bloating and abdominal discomfort. Changes in hormone levels may also lead to constipation. Alternatively, hormonal changes can result in diarrhea. Reduced estrogen levels can result in muscle loss. Decreased estrogen is associated with diminished muscle strength. Muscle loss and decreased strength can impair physical performance. Reduced muscle function elevates the risk of falls. Maintaining adequate estrogen levels is important for muscle health and overall physical safety. Hormonal fluctuations can be a significant factor in joint pain and stiffness. Reduced estrogen levels can specifically impact joint health. Estrogen deficiency may affect the integrity and function of cartilage. Decreased estrogen can also alter the properties of synovial fluid within joints. These hormonal effects collectively contribute to joint discomfort and reduced mobility. Perimenopause can impact the immune system's functionality. This influence may lead to increased vulnerability to infections. Hormonal fluctuations during perimenopause are a key factor. These hormonal shifts can alter the behavior of immune cells. Changes in estrogen and progesterone levels are particularly relevant. Consequently, the body's defense mechanisms may be compromised. The adrenal glands are responsible for producing stress hormones in the body. During perimenopause, hormonal changes can affect the adrenal glands. These hormonal shifts can alter the adrenal glands' function. This may lead to changes in stress response. Fluctuations in hormone levels can also impact overall energy levels. Therefore, perimenopause can indirectly affect the body's stress response and energy management via the adrenal glands. Thyroid function can be affected by hormonal changes during perimenopause. Perimenopause is marked by fluctuating levels of estrogen and progesterone. These hormonal shifts can influence the thyroid gland's activity. Thyroid imbalances can worsen perimenopausal symptoms. Symptoms like fatigue, mood swings, and weight changes may be intensified. Therefore, monitoring thyroid function is important during perimenopause. Hormonal fluctuations can influence the function of sensory nerves. Changes in hormone levels can trigger altered nerve sensations. One common effect is the experience of tingling sensations. Numbness in the extremities may also occur due to hormonal shifts. These sensory changes are often temporary in nature. The sensations are directly linked to the body's hormonal balance. Hormonal changes can significantly impact the activity of sweat glands. This influence can lead to episodes of night sweats. Night sweats are characterized by excessive sweating during sleep. These episodes are often linked to fluctuations in hormone levels. The altered sweat gland activity disrupts the body's temperature regulation during sleep. Reduced estrogen levels can lead to dryness of the mouth. This dryness is due to decreased saliva production. Changes in taste perception may also occur with reduced estrogen. These oral changes can negatively affect overall oral health. Discomfort in the oral cavity is a common consequence of estrogen deficiency. Breast tenderness and size changes can occur due to hormonal fluctuations. These symptoms are often cyclical in nature. These changes are frequently linked to menstrual irregularities. Hormonal shifts during the menstrual cycle can affect breast tissue. Estrogen and progesterone levels play a key role in these breast changes. Consult a healthcare provider for persistent or concerning breast symptoms. Decreased estrogen levels can lead to the weakening of pelvic floor muscles. Weakened pelvic floor muscles can result in pelvic organ prolapse. Pelvic organ prolapse can cause physical discomfort. This condition may lead to urinary dysfunction. Bowel dysfunction is another potential consequence of weakened pelvic floor muscles.